Hi, folks. It's Marvin Music with MedicareSchool.com, and we want to welcome you to this live stream event. We're actually going to take all your questions and do our best to get to everyone tonight. But before we actually start taking live questions and answering those, I do want to cover just a very quick topic to make sure that we kind of set the foundation for Medicare. I think it's real important that everyone understand that as you go on Medicare, you have a couple of options. And if those of you that may be taking notes, there's three options that we have available to us in using our Medicare benefits. One would be to have just A and B only. I do think, though I mentioned this first, it is the worst option, in my opinion, when someone doesn't have any additional insurance beyond A and B. Medicare says that about 10% of the population actually just has A and B only. And the reason I'm not a fan of that is just because of the tremendous amount of risk that people put themselves in by having A and B, because you always have to remember, if you have A and B, the only thing that Medicare pays 100% is preventive services. And that's it. So it's not in the list of preventive services that are covered. You're always going to be left with a balance of the bill. We call those gaps in Medicare, things they cover, but they don't cover 100%. And so when someone has A and B only, they're responsible for all of the financial gaps in Medicare. And I'm just kind of going to summarize those, that we have three gaps on the A of Medicare. We have three gaps on the B. And the problem with all the gaps is they're unlimited. They never stop. So if someone has a serious illness, they're going to be out of pocket an extreme amount of money. Everything on the B side, they're going to have to pay 20%. And on the A side, they're going to be subject to deductibles and copays for hospital. And so it's very, very expensive to have A and B only if you have any kind of a health problem. And so I really discourage people from going that particular direction. Now, I do want to mention one other thing about that. Right now in our country, there's about $220 billion of medical debt outstanding. So these are unpaid hospital bills, doctor bills, and such. And so as you look at this debt, the report out now is that the second largest holder of medical debt in the country, the second largest group that holds that debt, are Medicare eligible people. So why? Because many of those have A and B only. So I would discourage anyone from doing that. The second option we have of using our Medicare is to stay in A and B, original Medicare, traditional Medicare, but instead of being liable for all the gaps, you get a supplemental plan. The supplemental plan that is the most popular today is the G plan. The second most popular is N plan. Statistically, 70% of all people buying supplemental coverage today get G, 30% get N. My opinion is they're both wonderful. Very, very good options. G covers 5 of the 6 Medicare gaps. The only thing it doesn't pay is the B deductible once a year. And the N plan covers everything but the B deductible, as well as excess charges if and when they occur. Excess charges do not happen often, less than 5% of the time. We do see them only, of course, doctors are the only ones that can do it. And we primarily see that in cancer specialties. But the point is they don't happen often. But if you did have an N plan, the N plan is not going to cover excess charges if and when they occur. In addition, the N plan does have 2 copays. Every time you see a doctor, you're subject to a copay of up to $20. It may not be $20. It may be $12 or $18, but it can never be $25 because the max copay on the N plan is $20. And then if you go to the emergency room, you would have a $50 copay for that. And so on average, the difference in premium between G and N is about $30 a month. Some markets around the country, it's more than that, but just for comparison's sake, about $30. So some people who want most comprehensive coverage, the $30 isn't going to make them or break them. They may go with the G plan. Someone else says, I'll save the $30. I'm healthy. I don't go to the doctor. Probably will have very few copays and not worried about excess. Then they may choose an N plan. But the point is they're both wonderful plans. Now, the third way you can use your Medicare coverage is by enrolling to what is called a replacement plan or a C plan, Medicare C, also referred to as Advantage plans. And so when we talked about tonight's topic, we discussed what is the majority of people doing today. Well, statistically, 52% of all people that are going on Medicare are selecting Advantage plans, these private health insurance plans that are replacing original Medicare benefits. And so in order for someone to have an Advantage plan, they do have to be enrolled in A and B. They're responsible to pay for their Part B premium. But instead of having original Medicare, traditional Medicare directing and coordinating their care, and instead of being underneath the Medicare guidelines. Now they have a private health insurance company that is coordinating the care and has set up a particular type of coordinated care plan for them to use. And so they've opted with a private health insurance option. And again, 52% of all people are doing that today. The rest of them, of course, we know there's some that are doing A and B only, but then the rest of them have some type of a secondary coverage, which could include a retiree plan. It could include like a supplemental plan, but they're still in traditional Medicare, but using someone else to cover the gaps. All right, so those are the option, A and B only. Traditional Medicare with a supplemental plan, and then using a replacement or a C plan. These Advantage plans today, of course, are very popular. A lot of that has to do with the advertising that's conducted. The insurance companies certainly push Advantage plans. Agents push Advantage plans. And we write them as a company, but our main issue with Advantage plans is we just want to make sure that if people enroll in the plan, they fully understand what they're getting. All right. And so there is certainly a place for Advantage plans. But I think that the key to anyone going on Medicare must understand the difference between these. And so the question tonight was, should you join the 52% of all people that are going on Advantage plans? Well, maybe or maybe not. But be sure that if you do join them, you fully understand what you're getting. You fully understand how your insurance is going to work. And so I just want to highlight a couple differences, and then we'll take your questions. So again, I'm going to compare supplemental plans versus Advantage plans. The first thing that you'll notice between these two options is Advantage plans are always going to have a network. And if you're comfortable with the network, that's fine. You're either going to have an HMO Advantage plan or a PPO Advantage plan. Now, personally, I think if I'm choosing Advantage, I would want a PPO because it gives me a couple of options that I like. Number one, I don't have to have a referral from my primary care doctor to see a specialist if I'm on an Advantage PPO plan. HMOs sometimes require that. Secondly, the PPO plans do not confine me only to their network. I actually have the option to go outside of my network as long as the provider that I want to go to outside the network takes Medicare and will agree to take the plan. So I have some flexibility when it comes to providers. If I take an Advantage plan HMO, what happens is I have to stay in my network. I cannot go out unless it's an emergency situation or an urgent care situation. So I'm confined to my network. The problem is there are less providers that take HMOs than PPOs. Now, there are plenty that take them, but Advantage plan networks are very fluid. We may see a doctor in the network this year, and then they're out the next year. We may see a hospital that will pull their whole hospital group out of the Advantage plan because they had contractual problems with the Advantage company. And so you just have to realize that when you enroll in an Advantage plan, you are going to be part of a network plan. That's the way they work. And so HMOs have some more restrictions. They're also limited in amount of providers that you can go to. PPOs, we have more providers available to us, can go out of network. Now, keep this in mind. The Advantage companies, they make the HMOs more attractive financially for you, meaning max out of pockets are lower on HMOs, copays are lower, the perks that they're in are higher. So in other words, those insurance companies really want you to select an HMO because they have more control over the pricing and over what services you get with the HMO plan. So the point is, if you decide to do an Advantage plan, be sure you're very comfortable with the limitations and the restrictions that are placed upon you by that particular network. The second issue is you got to be aware of is that Advantage plans have the pre-authorization right. They have the final say-so when it comes to the healthcare services that you get. It is not your doctor. Doctor makes the recommendation, but if it's a pre-authorized service, which happens about 70% of the time, the insurance company has to agree with what the doctor's recommending. And sometimes they do immediately agree, but sometimes they don't. Sometimes they delay coverage. I've had people who needed a knee replacement, and the Advantage plan said, no, we'll pay for therapy to the knee first, or we want you to use, steroid shots to the knee. And so they can sometimes delay someone getting something. They also can deny. I had a lady not long ago that needed a full hip replacement on Advantage plan, and Advantage plan said, no, we'll pay for a rod only. You're not going to get a full hip on our plan. And that's all she got. And so those kinds of things, folks, you got to be aware that you're going to have to be fine with those because that's simply the way they work. And I mention this because so many agents today are pushing Advantage plans. And frankly, that's one of the reasons so many people are on them. The agents push them. And the reason agents push Advantage plans is because they pay us better. We make about twice the initial commission on an Advantage plan than we do on a Medicare supplemental plan. Pays twice as good. Plus, the way insurance business works, and all agents, if they'll be honest with you, will tell you, we don't make a lot of money off of any one person. This is truly a volume business, but it is also a residual income business, passive income. So what happens when someone enrolls in an Advantage plan, the agent who wrote it gets twice the commission than they would have on a supplemental plan, and they also get lifetime residual. Lifetime residual. Supplemental plans pay us residual for about 6 years. We're responsible for you forever, but they do pay us a 6-year residual commission. So the point is that one of the greatest advantage to the Advantage plan is the agent because they're going to make more money. And so you just have to be aware of why are they pushing it? Is it because they're convinced that it's going to be the best coverage for you, or is it the best commission for them? And so that's why I have a problem with agents only talking about Advantage plans. Their biasness is towards their bank account, not towards your coverage. So I think it's fine to get an Advantage plan as long as the agent you're dealing with tells you about both options, tells you about the differences, talks about network restrictions, network limitation, talks about the fact of pre-authorizations that you're going to have to accept that your doctor doesn't have the final say so. And then the last thing, which is the big thing, if someone takes an Advantage plan, you must realize that if you stay on that Advantage plan for a year or 2 or 3 or 4 or 5 years, 10 years, whatever, you stay on that Advantage plan, and now you want to get off of that plan and go back and get an original traditional Medicare with the supplemental plan, you're going to have to medically qualify to make that move, except in 4 states, New York, Connecticut, Maine, Massachusetts. You don't have to medically qualify, but everywhere else, if you want to get off Advantage and go to the supplemental plan, we're going to have to ask you 35 or 40 health questions. We're going to check all your medications you're taking now and have for the last 2 years, and may need a statement from your doctor. And so the point is, now you have to go through this process of being approved by the insurance company. Other than those 4 states, insurance companies are not required to take you if you stayed on that Advantage plan for any length period of time, year plus. And so if your health has changed in that period of time and you'd like to get a supplemental plan, you may not be able to. Because there's things that are simply automatically declinable. And I'm not talking about things that are life and death. I mean, rheumatoid arthritis. If you say you have rheumatoid arthritis, you're not going to move. You're on your Advantage plan for the rest of your life. If you have one AFib incident in your medical records, or taking Eliquis or a Xarelto, you're not going to move. You're going to be on that Advantage plan. Someone that's an insulin-dependent diabetic, if you're taking too much insulin, or you've had any diabetic complications, neuropathy or retinopathy, you're not going to move. If you've had cancer in the last 36 months, sometimes 60 months, you're not going to move until you're cancer-free and treatment-free. And so my point is, there's health conditions that happen, and not all of them are life or death, but they're serious enough where the insurance company says, we're not going to approve this policy. We're not going to cover those pre-existing conditions. And so what are you stuck with? You're going to have to be in the Advantage system. And so the whole reason I'm mentioning this is, yes, that's what the majority of people are selecting. But are they selecting it for the right reasons? Normally, they're selecting it because that whole Advantage system is packaged by the advertisers, by the insurance company, and by the agents as though this is the next best thing to sliced bread. And it's not. It just simply is not. And so that's why most have them, because they feel like, hey, I'm healthy. I'm turning 65. There's no premium on the plan. I can see my doctor with no copay, and the Advantage plan has given me all these nice perks. I can go to the gym for free. I can, I got a dental allowance, a vision allowance, covers hearing aids, over-the-counter cards. So all these perks are really promoted, and that's what everyone emphasizes is the perks. And they're legitimate for sure. I will tell you, they're underutilized for sure. Sometimes difficult to use because of restrictions placed by the plan, but they are certainly legitimate. But you have to ask yourself, are you trying to get perks, or are you trying to get insurance, quality insurance? I will tell you this, I'm not promoting Geico. I just happen to have them for my auto and home policy, and I like them. But as far as my auto policy with Geico, I don't expect them to pay for me to have a car wash or pay for my oil changes, but I do expect them to pay well if there's a car wreck that I've caused or someone hits me and doesn't have insurance. That's when I want them to perform. And so again, I don't look to them to anything other than give me premium insurance. And that's what supplemental plans do. It is premium insurance. I just read 2 government reports just recently for some videos I'm doing for our YouTube channel. And what people now are calling Medicare Advantage plans, they're calling them low medical coverage. And I thought that was interesting terminology, low medical coverage. Why is that? Because of network restrictions, because of pre-authorizations, because you go to a skilled nursing facility and the AI, the algorithm decides when you're going to leave, not clinical evidence. And so again, low medical coverage. So if you want low medical coverage and you want all the perks, then again, go with an Advantage plan. But if you want high, good medical coverage, premium insurance, and you're not concerned about the perks, that would be someone that wants a supplemental plan. So sure, most people are going on those, but again, are they going on them for the right reason? So folks, I think there is a place for Advantage plans. And that place to me would be whenever someone cannot, in their budget, put in the premium for the supplemental plan. And again, we're a nationwide broker, so I'm just kind of giving an average. Right now, a person turning 65 going on a G plan, that premium is going to be about $125, $130 a month. Drug plan, there's some that are 50 cents, some that are, a few dollars, but that coverage is not crazy high. But again, you're going to have to pay a premium. But what did you get when you pay the premium? You got to transfer almost all the liability to the insurance company. So if you happen to have something seriously go wrong, you're not hardly going to be out of pocket anything other than a small deductible. If you're on your Advantage plan, you have cancer or some serious issue, you could be out of pocket $3,000, $4,000, $5,000. If it's out of network, could be $10,000 or $12,000. And so don't make a decision just because you're healthy, 65, and you got a few perks that you want to take advantage of. Think long-term. I can tell you story after story. I'm not going to people that were very grateful that they went with the supplemental plan because it wasn't within just a few months of starting it. They ended up getting a cancer diagnosis and all kinds of MRIs, CAT scans, surgery, radiation, chemotherapy. And all they had to do is pay their small premium, a small deductible, and they enjoy the experience because they had no pre-authorization, can go to any doctor they want to. So that's the way I approach this. I don't approach it, hey, what's in my best interest? If that's the case, I wouldn't tell you any of this. I approach it as what is in your best interest. Now, again, if you can't afford that $125, $130 a month premium, then get the Advantage plan. If it doesn't fit in your budget, then that's a good reason then to get an Advantage plan. Why? Because people that cannot put that in their budget on a monthly basis are probably not going to keep it. And that's why I'm saying there is a place for the Advantage. But the place is not just so you can get a 0 premium plan that has a few perks. You have to be thinking about these other issues. Okay. And so I hope that helps. Again, I know I get passionate about this because I'm in the business. I don't just write plans and say, see you later. Have a great day. I made a great commission. I don't have that attitude. We have a customer support team. We have an obligation to you to help you to deal with claims. And so we're a part of it. It's not just inking an app so we can get a commission. It is taking care of our clients. So I think anyone who genuinely cares about people, instead of just chasing a commission, will tell you about your options, will tell you about the ins and outs of both of those options to make sure that when you sign up, you know that you have made the best choice for your particular situation. Okay. And really, I hope you'll go to our YouTube channel. This is your first time to actually be a part of our event. I've got lots of videos out there. Would love to teach you about how Medicare is going to work, Social Security, and all those things. Okay. So I hope you will reach out to us. I'm going to start taking questions. I do want to let you know the number at the screen. You can call anytime. Our office Central Time, 7 to 7, Monday to Thursday, 7 to 6 on Friday. So you can get a live call transfer to one of our agents. Listen, I have trained every single person that you'll talk to. In fact, I was in training all day today. So they share my commitment to do what's right. They share a commitment to make sure that we approach this unbiased. So we give you all the information. You're the ones going to make the decision. And so reach out to us. We'd be delighted to help you. Do you have a question that you're curious about? Call in as well. We'd be delighted to be a part of that and just help you really through this journey of Medicare. All right. Okay. So enough of that. I'm going to get started. Start taking some questions. So I am doing this tonight by myself. Normally, my son Josh is with me on this. So we'll try to get through this together. I hope you'll learn a lot. So this is a retired cop. Says my wife turned 65 August 29th. What will her Medicare start date be? It will be, also let me say it this way. She is eligible for Medicare August 1. Folks, you always start your Medicare on your birth month with one exception. If you're born on the first day of the month, then they always start your Medicare 1 month prior. And by the way, Social Security is the same way. So August 29th, your A and B effective dates can be 8/1/2024. If she was born August 1st, we'd move it back to July, and it'd be July 1. All right, next question. Hopefully. Next question. Here we go. All right, Deb's choosing a Medicare plan and having TRICARE for life confuses me. Which plan will I need? Okay, first off, Deb, someone served in the military, maybe it's you, husband, whatever, and thanks for doing that. TRICARE is awesome insurance. So let me tell you what your options are. Number one, though I love supplemental plans, I would not get a supplemental plan if I were you. It would be way too overinsured. So you really have two options. You can enroll in A and B, and TRICARE will pay second. Now, listen, TRICARE pays first up until the month you turn 65. Once you've turned 65, you're Medicare eligible. TRICARE now becomes a secondary payer. So A and B pays first, and then TRICARE is going to pay second. And that's one option you have. I can tell you what some veterans, in fact, many are doing today. What happened a few years ago, the Advantage plans began to coordinate with TRICARE as well. So TRICARE is willing to coordinate with A and B, and TRICARE will also coordinate with an Advantage plan. Now, the reason that some people on TRICARE are doing the Advantage plans, it's a little different than the normal market Advantage plans. They call them MA onlys, Medicare Advantage only. So in that scenario, if you enroll in an Advantage plan, you would still get your drugs through TRICARE insurance. But the MA plan, the Medicare Advantage plan, what it will do is it will give you some of the perks, of course, that you may find attractive. And then whenever you see a doctor or you go to the hospital, you would give them your Advantage card plus your TRICARE. So TRICARE will coordinate with them, and you should be out of pocket really almost zero. So that is an option. And another nice thing about this, there's a couple things. Number one, most Advantage only, MA only plans will give you a credit for your Medicare Part B. Some of them are $100 a month. So you can see a Part B reduction that's placed upon your account for the by the Advantage company. So it's called a B reduction, a B back. So that's a benefit. And the next thing I like about it is, if you don't like that MA only plan, you are not stuck on it like people who don't have TRICARE. People have TRICARE, don't have TRICARE, they're on their Advantage plan. They could be on it forever if their health changes. Not so with you. You can drop your Advantage plan anytime during Medicare's open enrollment and return back to just to have A and B with TRICARE insurance. So again, so it's something you can try. And again, a lot of TRICARE people are doing that. So that's your options: A and B with TRICARE, or you have A and B and you enroll into a Medicare Advantage only plan. No drug coverage. Get that through TRICARE. Take the B back and then get the perks, and then you can try that. Okay, you're not obligated to keep it forever. Okay, I rambled on that way too much. Let's keep going. Give me another question. Sorry. Jasper, does it matter if I'm turning 67 now, or should I wait until I'm 70 to start drawing my Social Security? If you don't need the money, my view is this: if you have longevity in your bloodline and you have family members that are living to be 85, 90 or whatever, and there's a high likelihood that you think you're going to live longer, I think it's fine to go to age 70. From 67 to 70, you're going to grow that count 8% a year. So you're going to grow that an additional 24%. And so if you don't have to have the money and you feel like you do have the possibility of longevity, in your family, then I think it's fine to wait to 70. Now, my plan is to do the very same thing, but I also, not that I necessarily know about longevity, but the benefit is, if you happen to be married, Jasper, if you go ahead and push it out to 70 and then you turn on your benefits and you pass away, you may not live long enough to get to that break-even point, but your spouse, if they're younger and they live longer, then they will benefit from you by waiting to age 70, because survivor benefit is exactly what the spouse who died, that living spouse, is going to get 100% of that Social Security amount. All right. So that's another benefit from waiting. So if you don't need the money, you have longevity in your life, maybe you have a spouse that's younger, I would, again, push it to age 70. Okay, my only income is Social Security. It's over $2,500 monthly. Will I have to pay Fed tax on my sole income from Social Security? And will Medicare also increase? Because, okay, so that means you're single, you're $2,500 a month. So that's going to be $5,000. So that's $30,000. And you're saying it's your only income. Okay, so here's the way it works. The formula, Andy, is called provisional income. So let me give everyone the provisional income formula. Provisional income is your modified adjusted gross income. Modified adjusted gross, that's line 11 plus line 2A on your tax return. AGI plus tax exempt interest. So line 11 plus 2A. Then you take half of your Social Security amount, which is, in your example, $1,250. So you add all that together, and that is your provisional income number. Okay, so again, modified adjusted gross plus half of your Social Security. That number is then put into a chart called provisional income. So here's the way it works. For a single filer, sounds like you are, if you make below $25,000 modified adjusted gross, which you do because you only have 1,250 times 12 Social Security income, but anyone that has 25,000 or less provisional income pays 0% of their Social Security will be taxable. Single filer that's between 25 and 34,000 provisional income, 50% of their Social Security income is going to be subject to income taxes. And then anyone as a single person that's above 34,000, 85% of their Social Security is subject to tax. So everyone is tax exempt 15%, but some are 0, some are 50%. They have to pay, some are 85%. Now, the married filing a joint return numbers are different. The lowest number is 32,000. So a married filing a joint return, if their modified adjusted gross plus half of their Social Security is below 32,000, 0% is taxable. Between 32 and 44, 50% subject to income taxes, and then anything above 44,000, which is most people when they're married, 85% of your Social Security will be subject to income taxes. Okay, and when you look on the 1040, you'll see where it says what is your total Social Security amount, and then it says how much is taxable, and that's the formula they follow to decide how much will be taxable. All right, so hopefully that helps. Let's go to another question. All right, I've been working with Medicare School the last couple of months, starting my Medicare July 1st. Very pleased. Every single time a question, staff answers is great. Well, Cheryl, I'm thankful that we get to serve you, and I'm glad your experience has been good, and I promise you, that is our goal. We love it when, people are taken care of. I mean that. We want you to be happy. So thanks, sorry. Next question, next statement. Is it true that if I initially sign up for an Advantage plan, you have to stay in one and cannot switch back to a traditional Medicare plan? Trina, no, you can switch back, but here's what happens. If you stay in that Advantage plan for year, 2, 3, 4, 5 years, okay, you stay on that and you want to get off of that plan, except in 4 states, New York, Connecticut, Maine, Massachusetts. Those 4 states don't have this rule, but all the other states, all 46 states and DC, if you stay on that Advantage plan a long period of time and you want to get off of that and come back to traditional Medicare, you will have to medically qualify. So yes, you can switch back as long as you're fairly healthy. Now, you can make that switch or apply for that switch 2 times a year. You can do it October 15th and December 7th, and you can do it the first quarter of every year. That's when we can switch back to traditional Medicare and get a supplemental plan. But again, if you've been on a while, you're going to have to medically qualify. And again, you don't have to be ready to run a marathon to medically qualify, but there are certain conditions you have where they would deny you. Okay, next. All right, my wife just applied for Social Security online. There was a question about whether she's applying for Medicare only, which she answered no. I assume the SS application was also, okay, here's the way it works, Dean. And if she's applying for Social Security, she answered that question correctly. When someone wants to do, in fact, I did one right before I got in the studio. When someone wants to apply for Medicare only, they go to ssa.gov and it'll say, is this for also for retirement benefits or just Medicare only? So she did right. That's what she did. But here's what I want you to realize. As she went through that Social Security application, again, I don't know how old she is, but I'm assuming she must be close to 65. They were going to ask her this question. They're going to say, do you want Medicare Part B? And she has to answer yes to that. Because when you're on Social Security or apply for it, they're going to automatically enroll you into A only. So at that time, if she's Medicare eligible, close to 65 within 4 months, then they should have asked her, do you want B? And if she does not have a group plan available where there's 20 employees or more on the group plan, at the company, That's the criteria. She has to take B. Let me clarify, folks. Everyone has to start Medicare at 65 unless they or their spouse are working, covered by an employer-provided plan that has 20 employees on the payroll, not in the plan, on the payroll or more. Okay, that's considered a large group. If someone's covered by their own or their spouse's employer-provided plan, 20 or more employees, they don't have to do anything with Medicare. They don't have to enroll in A, they don't have to enroll in B. But everybody else has to go on Medicare. So if you're no longer working, you're on TRICARE, you're on COBRA, you're on an ACA plan, Affordable Care Act plan, or you're in a small group, 19 or less, you have to go on Medicare at 65. So if that was your situation, when you apply for Social Security, you want to say yes to Part B. All right. If you already have a group plan you like, it's better than your Medicare option, then just say no to B and pick up B at a later date. We call that special enrollment. All right, let's go. I'm ready. Why don't you recommend Medigap Plan N? I do. I think Medigap Plan N is fine. I talked about G and N. G covers 5 of the 6 gaps. N covers 4 of the 6 gaps. So I am, in fact, in our practice, we're about 70-30, I think. So, hey, listen, I do recommend it. Especially if you want to save a little bit of money and you're comfortable, if and when there was an excess charge, they don't happen often, and you have some copays. So some people are fine with that. I will tell you, for me, I still would choose a G. And the only reason is because I don't want the surprise of it. I don't want to have to worry about anything. And the extra savings to me, $30 or $40 a month, is not going to make or break me. It just is not. And so I think it's fine to go with an N plan. So I really do recommend it. I'm just saying, I think you have 2 good options. You have a G plan and N plan. And however, what's most important to you, if it is that $30 or $40 a month savings and you're comfortable with a few copays and excess, if it happened, go for it. I think it's a great, great option. We write them every day, all day long. So sorry if I did not make that clear. I'm just saying, if I'm going on Medicare, those are definitely the top 2 plans that I would be looking at. All right. Can I keep my federal employee health plan and never sign up for Medicare? Yes, you can. That's called federal employee health benefit. You can actually just do A only. And then your FEHB is going to pay second. Here's the only thing, Jeffrey, that I would be concerned about if I were you is this. If you decide down the road to go ahead and enroll in Medicare Part B, if you've waited more than 12 months, you're going to start paying penalties. And I've seen plenty of federal employees that were disappointed that they didn't initially start with A and B. The reason people don't is they don't want to pay the B premium. And so, yes, you can. You have A only. So what's going to happen? Medicare pays first on the hospital side, and then FEHB pays second, you pay third. If you have no B coverage, then everything that's doctor-related services, outpatient stuff, then your plan FHB pays first, and then you're the second payer because Medicare is not going to participate. My view is for $174.70 a month for my Medicare Part B, I think you get a great value. Secondly, if you have a Fed Blue or GEHA, they're going to give you an $800 a year credit towards your Medicare Part B. So we just took that premium from $174.70, dropped it to about $100 a month. All right. So again, I discourage people from doing A only just because I've seen people regret that, but you can do it. And it's not like the craziest decision you would make, but I would make sure you think that through because again, down the road, you're going to be penalized if you want to pick up Medicare B. In fact, we had a guy recently had went without B for 10 years, wanted to get in B. He was on FEHB and what's his penalty? 100%. So it's just crazy when that happens. All right. Enough of that. Let's go to the next one. I am on Medicaid for now. What happens when I turn 65? Well, John, you may lose your Medicaid eligibility. Some do, some don't. So that's the first thing that I would do if I were you. Are you going to keep your Medicaid eligibility once you're eligible for Medicare? And if you are, then what's going to happen is more than likely your state Medicaid will probably cover your Medicare Part B premium. They normally do that. And then what you will be eligible for because you have Medicare and Medicaid you'll be eligible for what's called a dual SNP plan. These are called special needs plans. Dual eligible means you qualify for Medicare and Medicaid. And those dual eligible plans, they are Medicare Advantage plans, but you have a zero premium and really anything out of pocket. So what I would do if I were you is I would pick a dual eligible dual SNP plan and find the very best plan that you can get that's in your area based upon your doctor choices and hospital choices. And so that's what you do. And you can begin to shop those just so 3 months before you turn 65. And so once you get within that time frame, if you want to give us a call, we'd be delighted to help you with that. We do write those dual SNP plans. All right. Do both G and N plan cover a hospital side deductibles, copays per day? Yes. Are you hospitalized 4 times per year, every 60 days with the 16? Yes. Okay, so either the G or the N, Susan, will cover every gap on the A side of Medicare, which is the deductible, multiple times, extended hospital copays, as well as skilled nursing copays. So the identical coverage for G and N on the A side. On the B side, the only difference is the N doesn't cover excess, and again, it's pretty rare anyways, and you do have some copays. So very identical coverage on the A side. All right, with high blood pressure or high cholesterol medications preclude you from passing underwriting? Not necessarily. Now, let me share this with you. High cholesterol, pretty common. A lot of people take that. I would tell you with high blood pressure, as long as you're not taking, some companies will take up to 3 high blood pressure meds and give you approval. Okay, if you're taking 4, probably not going to happen. So it just depends exactly what you're taking. And they also may ask you, has it been controlled for a while? So if people are having to change and adjust their blood pressure medications, that could be an issue. I will tell you, so blood pressure really is fine. Now, if there's some other kind of heart issue going on that they're treating, probably not going to get through underwriting. But blood pressure really not a problem. And again, unless we're taking too many meds or we've been unstable with those meds. Cholesterol is fine. All right, next. The Medicare Advantage plans are zero cost. Why would someone choose an HMO over a PPO? Well, it could be because they are looking at the perks. Now, when you're talking zero, you're talking about premium. But when it comes to the copays, your HMO copays will be lower than the PPO. That's why some people may do it. The max out of pocket is lower on the HMO than the PPO plan. But then also, as I said earlier, companies want you to go to HMO because they have more control over that. And so they have higher perks. For instance, PPO plan may give you, let's say, $1,500 worth of dental allowance. An HMO may give you $3,000. And so again, the perks are a little bit more attractive on the HMO. And so that's why it would happen. You're right. Most of them are zero premium plans. There's actually 3,800 Advantage plans in the country today, and 2/3 of those have a zero premium. So the majority of them do. But then we have to get into the other details to find out what copays, coinsurance, and those things are going to look like. All right. Okay, can you change between G and N annually? All right, so here's the way it works. There are about a dozen states that have what we call a birthday rule. Let me list them off just real quickly. Those states are California, Idaho, Arizona. No, not Arizona. I'm sorry, Nevada, Maryland, Louisiana, Illinois. Oh boy, I'm blanking. Let me start those over again. Let me go West Coast, East Coast. So they are California, Oregon, Idaho, Nevada, Oklahoma, Missouri, same thing called the anniversary rule, same concept, and then Illinois, Maryland, and those states have a birthday rule. And so some of those states allow you around your birthday. Sometimes it's 30 days before the birthday, 60 days after, sometimes from birthday on. But you have this window of time surrounded around your birthday, give or take a month or two around there, where you can move plans. The majority of the states allow you to go like to like or like to less. So G to G or G to N. But none of them are going to allow you to go from N to G, exercising the birthday rule. Okay. Now, again, the majority of states don't have that anyways as an option, but birthday rule means you can switch, you can change plan types, like or less, and companies. Now, state of Illinois, you have to stay with the same carrier. State of Louisiana, got to stay with the same carrier. All the rest of those I mentioned, you can change carriers as well as plans. State of Washington actually allows you, if you own an Advantage plan, you actually can make that switch like to like or less year round. New York, Connecticut, Maine, and Massachusetts, they will allow you to do that at different times of the year as well. So again, that's what I'm saying, about a dozen states. So that's what you got to find out. Do you have a birthday rule state or a state that doesn't have any rules, which are New York, Connecticut, Maine, Massachusetts. And Vermont also has certain rules with Mutual of Omaha, United Healthcare. All right. So beyond that, beyond those dozen states, if you want to move from a G to an N, you're going to have to medically qualify to do that. That's my whole point. Whatever plan you go with in the other states, you will have to answer those 35, 40 health questions, check your medications to do that. So, Lauren, I don't know where you live. So it's just state specific. Okay, let's keep going. I didn't mean to ramble off on that one. I'm about to turn 64 in a month. Is this too soon for me to start to think about it? No, I think it's smart. If you're just now entering into our channel, watch a lot of videos and really learn about it. I think it's smart. What I would do, about 6 months out, that's when you can actually enroll and get things moving in that right direction. But it's fine to learn and get a feel for what you're comfortable with. No problem at all. Okay, at 65, can I go on my wife's federal employee health plan and not be penalized for not signing up for Medicare at 65? Okay, so the issue with that one is if your wife is still actively working, okay, so I'm going to assume she is. And the answer to that is yes. And you will not be penalized by not taking Medicare now, because anyone that's covered by a group plan, theirs or their spouses, that has 20 employees or more in the payroll, federal government does, then you don't have to do anything with Medicare A or B, and you're not going to be penalized. Now, if your wife is retired, it's different. If she's retired and you're going to go on her plan, then you can choose to have A only. But if you want to get B at a later date, as I talked about earlier, then you would be penalized for every 12 months we go without B when we should have it. Then we're going to be penalized 10% per year. So if she's still working, you're fine. If she's not, you're going to have to make the decision like every FEHB person does. Am I going to go A only, run the risk of not having B and pick it up a later date, or take it now and then have FEHB pay in the second payer position? All right, Jeffrey, that's the answer. Okay, number one, we'll start Medicare, not on Social Security yet. Any issues here? Not at all. In fact, if you're not taking Social Security, that system for you to enroll is going to open up about 3 months, about 100 days. I did an application right before I got in here. The lady's starting Medicare in July. That's her birthday. And so we did an enrollment for her online today. It's April. So again, that time frame, about 90 days prior, you can go online, set up your myssa.gov account, and you can do an A and B enrollment. And by the way, you work with us, we'd be happy to help with all that. We do that for our clients. All right. So that's that. What happens to my Med Sup plan if I move from California to New Hampshire? Medicare supplemental plans are written for lifetime. Okay, they are lifetime plans. They can never be canceled by the insurance company unless you don't pay it. Okay, so they can't cancel because you relocate, can't cancel because of age, can't cancel because of claims. It is your policy for life. So here's what happens when you move to California, New Hampshire. The plan's still yours. If you have a G plan, F plan, M plan, whatever you have, take it. The only thing that can happen is that insurance company does have the right to re-rate you, to adjust your premium. I would suspect probably going to be very similar, but that's all they can do. Can't cancel it, but they can, if normal and customary expenses are higher in New Hampshire than California, then they could raise that premium a little bit. I've had people move all over the country. I've never had someone cancel a Med Sup plan because of relocation, ever. All right. Okay. If one chooses supplemental G or N, does one sign up for D separately? Yes. In fact, those are called standalone drug plans. When we have an Advantage plan, it's embedded. It's included unless we're veteran, TRICARE, or FEHB. Everyone else, you're always going to want to get a Medicare Advantage that includes prescription drug plan. So when we get a supplemental plan, supplemental plans do cover medications, but it's professionally administered meds, just like A and B. A and B covers meds, inpatient, outpatient. So your supplemental plan does cover meds, but our self-administered meds, cholesterol, blood pressure, those kind of things, you're going to get a separate D plan. And you work with us where we show you how that system works. And you pick a plan based upon the meds and pharmacy choices. But it's a separate plan with a separate policy and a separate premium as well. There's several that are very low cost. Depending on what kind of meds you take will determine what plan you want to be on. Okay, I've heard some doctors' officers saying they won't accept Medigap policies if they're not used to working with that particular insurance company. Does that sound plausible? Absolutely not. I mean, that's ridiculous. And I'll tell you why. Because you have the right to select any supplemental plan you want, any plan, of the 10 letters, 8 if you're born after January 1st, 55, any company. And they have to accept it. If they take original Medicare A and B, they have to take your supplemental company. Now, I will tell you, we have 40,000 clients, and I've never had anyone tell me that they've ever experienced what you're experiencing, ever. So that is, these supplemental companies, they have to pay. If Medicare pays, they follow. I've never had a Medicare supplemental plan fight a bill ever. So why would a provider have an issue with that? that's somebody to me that's, I don't know, a rookie or something. I've just never heard of that scenario ever. Sorry you're experiencing that, David, but I've never seen it personally. Okay. All right, let's go. All right. What do you, has experience, expect caps on sub G cost rising, straight ABD, well care, and UHC for G? Okay. Listen, medical inflation has been a terrible reality lately. A lot of people were not getting healthcare services during COVID. That's changed now. Everyone's, getting things that sometimes they put off for a couple of years. So we have seen some disappointing price increases. Not crazy, but it's disappointing. And so I don't really know. I would tell you as a general rule, we're in that range of, maybe 4 to 7%. I know it's been higher than that this year for sure. But I think after everyone gets caught up with all these services that they should have done that they didn't do because of COVID, I think we're going to return to some, more price stability. I do. But anyway, so straight ABD, well care, UHC for G. I think it's a good option, what you chose. I really do. I know some of these price increases have been disappointing, but it's still great coverage. I mean, it's awesome to be able to go to any provider that takes Medicare, no pre-authorizations. Folks, that is high quality insurance. And to me, it'd be worth the extra premium to do that. Okay. All right, Yolanda, I'm presently working, turning 65 by July. Do I need to apply for Medicare A and B, and I will not be penalized? Do you recommend supplemental advantage plans? Thanks. So number one, Yolanda, if your group plan has 20 employees on the payroll or more, you do not have to do anything with Medicare A or B. You don't. So if you're in a small employer, 19 employees on the payroll or less, you have to enroll in a Medicare A and B because Medicare is the first payer. Your company plan would be second. So I'm assuming, like most people, you're probably in a large group, so you don't have to do anything whatsoever, A or B. Now, if you're on Social Security, you'll be automatically enrolled in A and B. But if you're not, then you don't have to self-enroll and you won't be penalized. The only reason people are penalized for Medicare is if they should be starting at 65. And again, I've talked about who those people are. People that are no longer working, people on TRICARE, on COBRA, ACA plans, small group plans. You have to go on Medicare at 65. But if you have a group plan 20 or more, you like the coverage, you won't be penalized. Once you lose that plan, then if you don't start Medicare within 8 months of losing the plan, you'll be penalized. But listen, you don't ever want to wait 8 months anyways. Folks, here's what happens. When you know your group plan is going to end, let's say it's going to end this month, April 30th. You want to start Medicare May 1. I know that you have this 8-month window if you didn't start Medicare at 65, as long as you're covered by group plan. But don't use that 8 months because you'll be covered by COBRA and you're the first payer. COBRA only pays second. So as soon as the group plan ends, go on Medicare. Next day. Okay. All right, I have Part A and B, but what plan helps with dental and glasses? Need to know. Would you get a medical advantage program? Okay, so first off, Medicare covers vision very, very well. I'm talking about traditional Medicare and your supplemental plan. Covers vision wonderfully. Glaucoma, cataracts, macular degeneration, shots in the eyes, all that's covered. The only thing original traditional Medicare does not cover with vision would be eyewear, unless it's after cataract surgery, and exams for eyewear. Other than that, you've got great coverage by traditional Medicare. If you opt to have an advantage plan, what they're going to do is they are going to, if you have, cataracts or something, you'll have a copay for any kind of a procedure. And then they will give you one free eye exam a year and they'll give you a credit towards eyewear. That's why I talked about perks. That's a perk that Advantage plans throw in. It's about $250 a year for eyewear, glasses, contacts, and then one eye exam. All right. Now, I personally wouldn't choose an Advantage plan for that reason. I'm concerned about all these other things that I talked about. Permanency, pre-authorizations, provider networks, all that. But if you're going to go with an Advantage plan, they will give you an additional benefit on your eyewear. Let's talk about dental. Medicare covers no dental other than it's major, cancer, jaw cancer or something. They got to do reconstruction. So if you want dental and you have a supplemental plan, you are going to have to buy a separate dental plan. Most of them run about $45 to $50 a month. They cover usually for about $3,000 of annual benefits. So they are a legitimate plan. Get a PPO plan so you can go anywhere that you want. And so if you have an Advantage plan, then they will include a dental allowance. Sometimes those are $1,000 a year, $1,500. It varies plan to plan, but you'll have a dental allowance. And the main thing is to make sure your dentist takes it and how it's going to be billed, because some of the plans you pay first and they reimburse you up to a certain limit. All right. So again, you got to really decide which system you're going to use. Okay. Were you saying that take Medicare and be in a supplemental plan was the best supplemental plan? I am suggesting, as long as you can afford, put in the budget your supplemental premium, as I said, $125 a month or so for a G, about $100 or so for an N plan. If that fits your budget, then that's what I think it's absolutely the best option. Is definitely what I'm going to do. But sometimes people can't put that in their budget, so then they ought to get an Advantage plan. And so I favor subs only because I know it's premium quality insurance. No perks, but the quality insurance is wonderful. Folks, we get no complaints on supplemental plans, zero. The people who complain are those that are an Advantage plan, and now their loved one got kicked out of the nursing home because the algorithm made the decision you got to be done in 18 days. So, or someone wants a knee replacement, they don't get it, they get rehab instead. That's the problem with Advantage plans, the quality of the medical coverage. So you got to decide what's important to you. As far as best supplemental plan, I told you I would do a G. I think N's still a great option. It's a little bit lower. So I think it's fine. So I would do a G plan or an N plan. I think they're both great options. Okay. As far as companies go, I can't tell you on this channel, we would get in trouble for that. Let's keep going. Can you change providers on a plan G, or are you stuck with who you choose when you signed up? Okay, Karen, I addressed this earlier. Just depends on where you live. There are some states that have called the birthday rule. You can switch carriers at a certain time of the year around your birthday. And you can move from a G to a G or G to an N with no underwriting. Those states, I rounded them off not very eloquently earlier. There's about a dozen of them. If you don't live in those states, and again, we said California, Oregon, Washington, Idaho, Nevada, Missouri, Oklahoma, Illinois, state of Maryland, New York, Connecticut, Maine, Massachusetts, those states, you have some opportunities to switch plans without any underwriting. Again, around your birthday, Missouri, around your anniversary date, state of Washington, anytime during the year. I know Vermont, it's anytime, but only with Mutual of Omaha, United Healthcare. Maine year-round. I'm sorry, that's not true. New York and Connecticut year-round. Maine and Massachusetts, they have a couple months every year where you can do that. Okay. So again, it's very state specific, but if you're not in one of those states I mentioned, one of those dozen, then you can't move from a G to a G or G to an N without underwriting. Okay. Excellent customer service. It came to you because of your vids. Oh, good. Robin, thank you. Appreciate the encouragement. We work hard on our YouTube channel. We have a gentleman who oversees all that. His name is Daniel. He's great at it. And I love giving the content and doing the presentation. He's got to do all the other work. So we appreciate the encouragement. Okay, I'm retiring in 5 months, going on Medicare, age 68. Do I have to stop continuing my HSA sooner? Yes, sir. Okay, or miss. Okay, here's the way it's going to work. When you apply for Medicare, let's do it this way. Let's say you applied this month. At your age now, folks, you turning 65 doesn't apply. So let's say we applied this month. It's the month of April. What they're going to do is they're going to backdate your A date. So they're going to backdate it 6 months. So let's go back 6 months. So if we applied in April, they're going to go back March, February, January, December, November, October. So you're going to have an A date if you apply today of October 1 of 2023. They always backdate 6 months. They never backdate before 65, but they go back to 65 or 6 months, whatever is first. In your situation, 6 months. So you would have an October 1, 2023 A date, which means technically you should not put any money into your HSA after that date. Now that's if you're maxing out. If you're not maxing out, you're putting $100 a month in, it's not going to matter because they take that annual amount. Write this down, $4,150 a year. Plus, if you're over 55, you get an extra $1,000. So it's $5,150 you can put in. You divide that by 12, it's $430 a month. So when you take your Medicare, you can prorate it for all those months until you start Medicare A, and then you have to stop. So again, if it's $100 a month, it's not going to matter. But if you're maxing, you want to be sure that you know it's going to be prorated, because if you overfund your HSA, then there's a penalty. I think it's 6%. Plus, you got to pay taxes on that money. If you've done that, don't panic. Just tell your accountant. They know how to make those adjustments. Okay. All right. Keep going. All right. New York had an MA plan with Humana of 7 years. Fortunately, I had no problem. I was healthy. This year, I decided I'm older. I was able to switch to a Medicare plan with no underwriting. That's exactly right. Because you live in New York, they have year-round open enrollment. Connecticut does the same thing for sure. Vermont does, but only supplemental plans with Mutual of Omaha or United Healthcare. All right, so good. I'm glad that worked out for you. It's wonderful. You live in that open enrollment state. No problem. Okay, covering my husband's insurance, works for the state of Wyoming. I'll be 65 in August. What should I do? Okay, so he's still working. So, Julie, you don't have to do anything if he's going to keep working. You don't have to have A and you don't have to have B. Now, if you don't have an HSA that you are contributing to, you can enroll into A only. Okay. But if you have an HSA, I would do nothing at all. Now, as your husband prepares for retirement, then you're going to enroll into A and B as soon as his coverage ends. So let's say his coverage is going to end, let's say July 1. Then you would make your Medicare start July 1. Okay, so you don't have to do anything yet, Julie, because state of Wyoming is going to have more than 20 employees on their payroll. And so nothing is required at all. Okay, but do A only if you don't have an HSA. It's fine to do that. Okay, if I choose Sup N, can I change to Sup G later on? Well, yes, you can, but you'll have to medically qualify to do that. And so as long as you're fairly healthy, that you can, for sure. No problem. And the good thing about it, you can do it anytime during the year. Now, if you are on an N plan and you have AFib, no, you can't. If you're on an implant and you have, spinal stenosis, rheumatoid arthritis, psoriatic arthritis, you are an insulin-dependent diabetic that takes more than 50 units a day, or you have complications, you're not going to do that. So the point is there's some health questions that as long as you can say no to the health questions, you can make that switch anytime during the year. Is it necessary to get medical insurance for my previous employer, Medicare A and B? I may not be able to afford both. Okay, no. Wait, let me back up. Oh, see, previous employer. Okay. Okay. Well, here's the bottom line. That decision has to be based upon if you're no longer working, you have to go on Medicare. A is 0 premium. B costs $174.70. And so the only reason someone would keep previous employer coverage would be if they had some kind of a secondary plan. And those are really few and far between. Sometimes I've seen unions offer that. I've seen some state governments offer that. So it depends on the cost. But I would tell you this, you got to enroll in A and B if you're no longer working. So what I would look at is what would it cost you to stay on that plan from the previous employer? And if it's, $150 a month or up, I wouldn't do that. I would just take a traditional supplemental plan, or if money is really tight, enroll in A and B and get the very best Advantage plan you can. I would, because most of those are 0 premium. So that would be the most affordable way to take care of your Medicare. Medication, okay. All right. And the answer is no. Yeah. Just because you don't have any kind of current insurance, it doesn't matter. Now, it would matter if you try to come on a Medicare at a later date. But if you're going to start Medicare at 65, the only qualifications to start Medicare is you have to have 40 quarters paid into the tax system, 10 years worth of work paid into Medicare, you or your spouse or ex-spouse. Then there's no prior coverage questions whatsoever when you start Medicare at 65. Now, if someone is going to start at a later date, if they've not had prior coverage, then they've got problems, because then you can only come in during the general enrollment period. You'll probably be penalized for doing that. So that would not be a good option. Okay. But to come in at 65, you just need 40 quarters. That's it. All right. Can the guaranteed period of Medigap extend until I stop working? Hey, that is a great question. I wish I would have made that clear, because yes, as long as you're covered by a good group plan, 20 people or more, on their payroll, then you don't have to take Medicare B. And then once you lose the group plan, then you enroll Medicare B. And then that period of time where you have no underwriting called the Medigap open enrollment period, that's when it begins. And that's what I wish I would have emphasized earlier. That 6-month window where there's no underwriting is tied to your B date. You can apply 6 months before B date and everything starts at the same time, or you can apply within 6 months after B date and there's no underwriting at all during that period of time. Insurance companies have to take you. We call that a guaranteed issue. Have to take you. All right. Will the diagnosis of osteoporosis keep me from medically qualifying on a supplemental plan? Yes. Yeah, it will. Yeah. Osteoporosis is always a question that's asked. Now, I will tell you this, Regina, there are some carriers that say it this way. Have you in the last 24 months been diagnosed with prescribed medication for osteoporosis with fractures? Okay. So I have seen some carriers that are lenient as long as there's been no fractures. Now, if you're taking Prolia, I think the other drug is Lendronate, and Lendronate ought to be fine. But if you're taking Prolia, you probably would be denied because of that. That's, the 2 shots a year. So I don't want to say emphatically you're not going to get it, but I know you wouldn't if you had fractures, and I know you're not going to get it if you're taking Prolia. So if you just had an osteoporosis diagnosis only, there may be a carrier that would look at that. I'd say they'd probably look at other situations too to see if you're generally healthy. But I promise you, if you're taking Prolia, you're not going to get approved. Okay, I'm 71, still on my company plan. It costs about $700 a month. Whew, am I better signing up for Plan B and a sub? I think you're a lot better off. Now, I don't know how much money you make because sometimes people that are high income, not sometimes, they always have to pay an IRMA. But boy, pushing $700 a month, I would definitely go on A and B and get a supplemental plan G or N. I think you'll save money. You'll probably be about half. All right. And your company plan probably has a higher deductible than what your Medicare is going to be. So I definitely would do that, sir. And by the way, here's what it works. Most companies let you go anytime. Some companies will let you go on Medicare if you keep working during their open enrollment season. Got it? Now, employers have to let you go at 65. But in the future, if you want to go like you are at 71, you may ask them, can I do it anytime? Or they may say, no, you can do it during our company open enrollment time. All right. Okay, my wife turned 65 in 3 months. I'm currently on a G plan. Would you suggest that I change to the same carrier to get a family discount? Not sure as even an option. Well, sometimes. In fact, I kept telling you about this case I worked with right before I came in the studio, and that's what we did with them. Now, they didn't switch. She actually went on the same carrier. So he had selected a carrier about a year ago, and I wrote her today. And so that company offered a 5% household discount. Both of them have to be with the same carrier. And so if it makes sense to move, and you may have to medically qualify to move, I don't know where you live or what plan you're on, but if you can medically qualify and it will save you money, I think that's a smart option. And keep this in mind when it comes to household discounts. Every carrier is a little bit different. Some carriers give you a household discount because you live with someone or are married to someone that's above the age of 50. One carrier, it's above the age of 18. Some carriers only give a household discount if both of you are with them. You got to have your policy with them. So it really does vary. So as brokers, we kind of look at the variables of the household discounts, but it's good to take advantage of that. I certainly would if you can. All right, you're on a Advantage plan in one state, later move to a different state with either guaranteed enrollment or birthday anniversary. Do you still qualify for a Medigap sub? And the answer is yes. I'm pretty sure that when you are on a Advantage plan and you change states, then that gives you a guaranteed issue period in your new state to get a supplemental plan that would be available in that particular market. So I believe that's the way that it works. I will tell you this, Scott, I've had very few people in my career do that. So I'm pretty sure you're right. I think it's accurate. So I'm going to go yes to that. There are just some states that have kind of different rules, but I'm pretty sure most states are going to require that the insurance company take you for that reason. All right. Okay, Jeff, heard from a rep. Wisconsin does not have typical Plan G and Plan A. It's true. They don't call them that, but they have lookalike Plan Gs and lookalike Plan Ns. It's just different. Wisconsin does this, Minnesota does this, and the state of Massachusetts, they kind of have their own plans, but they are very similar in coverage. They just call it something different. So I just refer to them as a lookalike G or a lookalike N. My age, and it costs us something. I don't want to qualify for a G plan. Okay. No, David, you won't. In every state in the country, When you turn 65, you're going to enter into what we call your IEP 2. It stands for Initial Enrollment Period 2. So obviously you live in a state where you're able to get an Advantage plan to take care of your Medicare because of disability. That's all great. And then when you turn 65, you get to reset the clock. And it really is a wonderful opportunity for you to be able to do that. And there's no underwriting. They have to take you a guaranteed issue. They can't charge you extra because you had disability before. You'll get the normal 65-year-old rate. So once you hit 65, answer is yes. Any plan, any carrier, no underwriting, and normal cost. Scott. 62 miles short, 120 employees, just my wife, and she is 3 years younger. Okay. Here's the way it's going to work, Scott. Because you are on Social Security, you're definitely going to be automatically enrolled into Medicare A and B. Okay. But what would happen if you do keep the A and B, then your wife's plan pays first, Medicare pays second. Okay. So the way it works, anyone that's actively working, Medicare always takes the second payer position when the group is 20 or more. And obviously you're telling me that's the case. So Scott, what I would do if I were you is number one, I'd want to find out what does it cost your wife to cover you? And so if it's, $200 a month or less, what I would do, I would go ahead and just drop off the Medicare B. And I would have A only in that scenario if she's going to keep working for a while. You don't have to have B if you're covered by a group plan, 20 employees or more. And the way you do that, Scott, there's two ways. When the Medicare card comes, if you want to do just A only, mail the card back in. You got to turn it over, check a box that says, I don't want medical insurance, which means I don't want Part B, and mail the card back in, and they'll send you a new card that says A only. If you keep the B, you're going to have to start paying for it. And again, it's the second payer. So I wouldn't have it in that scenario. Do dental plans cover in and out of network with the same level of coverage? Well, here's the way it works. If you have a dental plan that covers you for $3,000 a year, that company is committed to covering you for $3,000 a year. But if you're using a non-network dentist, what could happen is the cost of those services could be higher. That's all. So, and I'll just make this up. Let's say you're having a crown in network, it's $1,000, out of network, and maybe $1,250. So you still get $3,000, but that $3,000 is not as efficient. It's not stretched out as much if you go out of the network. Okay. Yeah, Jacqueline. Yes. Now, when I talked about 6 months, I was also talking about people that are contributing to an HSA. They always want to stop contributing 6 months before they apply. But if that's your question about HSAs, then yes, 6 months before. If you're asking just about contacting us, that 3 to 6 months in advance of retirement is ideal. 6 months is fine. Some states allow us to even submit applications 6 months in advance, but some states are 3. So depending on where you live, but reach out to us. We'll tell you exactly what to do and the right time to do it. No, Tom, if you have any form of Medicare, A or B or both, no new money can go into your HSA. And so when people enroll into A only, that's one of the biggest problems. They can no longer put money into their HSA. Okay, Elaine, no, the price is all the same. Whether you use a broker or use, go directly to the company, we don't set the prices. The insurance companies do, and they're the same across the board. So let's just say, United Healthcare, Aetna, whoever, and the price is $130 with them. It's also $130 with us. It's the same policy. It's just a matter of who you get assistance from, whether it's, they're toll-free people or you call us and we serve as your broker. Price is all the same. I think there's a big difference in service because number one, we're US based. You call us, we understand Medicare and we speak English. Some of these call centers today by these carriers, good luck. A lot of times the biggest problem, they don't know Medicare very well. And sometimes you can't understand it very well. So that can be really frustrating. Price is all the same. No extra by using someone like us at all. All right. Turn 65 in December. Plan to go on Medicare. I will talk to your team, but is your recommendation to engage with your team until September 1? But is your recommendation to engage with your team? Oh, no. We'll talk to you anytime. Hey, call in now. Well, I don't know about now. Yeah, the phones are open still. Yeah, call in tomorrow. And happy to engage in a conversation for sure. Right now, it's no problem at all. I'm just saying when it comes to enrollments, some states we can't submit application until 90 days before the effective date. Some states are 180 days. So depending on where you live, but we're happy to engage in the conversation whenever you want. If you're curious and want to know now, give us a call. We'll help you. Why is AFib ruled differently? Well, because AFib is a pretty serious heart issue. And I know for some people it's treated with medication and they're not worried about it. But it's serious enough where the insurance companies say, we're not going to approve your application if you've been diagnosed with AFib. It is an automatically auto decline with every single carrier. Now, remember, if you're starting Medicare at 65, they're not going to decline you because they can't. But if you're going to go on a supplemental plan after 6 months of your B date, except in those 4 states, you're going to be declined. So that's why when people have serious health problems, they better start with the Med Sup plan. I'm 65, just started with UHC Sup with copay. Is 102 a month. Just got a notice it will increase 116.20. This is over. Okay. Well, okay. So with copay, so I guess you're on an N plan. It would be my gut feeling, because if you have a G plan, you don't have copays. You meet a deductible. But regardless, I know it's 13%. I got that. But we went up $14. And I'm disappointed by those kinds of things, but it's still a wonderful, wonderful value. Okay. It just is. And I'm not trying to minimize your pain for an increase of 13%, but it went up $14. And they're still going to cover you wonderfully if you have any kind of a health problem. Okay. Not worked in on my spouse work insurance plan. Do I need to sign up for Medicare at the end of the year? Not necessarily. As long as the group plan is 20 or more, I mean, the employees on the payroll, 20 or more, don't have to do anything with Medicare. Okay. If the group plan that she's covered by has 19 employees at the company or less, this means 19 on the payroll or less, then yes, you have to start Medicare A and B. But if it's 20 employees or more on the payroll, don't have to do anything at all with Medicare. Now, if you don't have an HSA, I would still enroll in A only. If you have an HSA, I would do nothing at all. All right, just enrolled a Social Security Medicare today. What's the best way to choose a carrier? Well, best way, call us and let's talk about it. We will show you a service that we prescribe to so we can look back at the history of the companies over the last 10 years. So what you're looking for, Tommy, is the initial premium to be competitive, and then also, though, a projection for what we think the rates are going to do in the future. And again, we don't know for sure. No one knows that, but we can look at the history of these carriers. What have they done in the last 10 years? How often do they raise their price increases? That matters. And so that's what I would do. I would reach out to us or someone who has that information available to you that is looking to give you the most price stable company that's in your market. All right. So it takes a little bit of homework. We can show you. If you do business with us, we'll do a screen share with you. And you can actually see what we see, because stability of rates really is the most important thing. What are the rates going to look like in the future? No one knows, but we can still look back at the past. Okay. 69, working full-time in Minnesota, have coverage under my large employer. I have A. When I retire this summer, do I immediately sign up for B and a SUP? And the answer to that is yes. What I would do is about 60 to 90 days before you retire, do the paperwork. It's called SCP paperwork. We're happy to go through that whole process with you, and then pick out your supplemental plan and your drug plan. So again, 60 to 90 days before you retire is the right time to do that. It is more common to do A and B or an Advantage plan. Most common right now is, of course, keep in mind, you got to enroll in A and B to get an Advantage plan. So I guess that's what you're saying. So yes, the answer is yes. 52% of all people that are enrolling into Medicare today are selecting Advantage plans. And I said earlier, you probably weren't part of but make sure you go on for the right reason. Don't go on because of zero premium and perks. Don't do that. Go on it because you're comfortable with the way the insurance is going to work. You're fine with networks, you're fine with pre-authorizations, and you're fine with permanency if your health were to change of being on that plan. So go on for the right reason, because Advantage plans and supplemental plans are totally different systems. Be sure you're comfortable with whatever you choose. May able to have Medicare A and B or A and M better med insurance is second. No. Okay. And better, it would be an ACA plan, Affordable Care Act plan. And the reason you don't want to do that is because you may have Ambetter now, and you're probably getting some type of tax subsidy, reduced premium, cost sharing by the federal government. But once you turn 65, all those benefits are going to go away. So if you kept Ambetter, you will pay the full premium, you'll get no help, and you'll pay the full cost sharing, which they have high max out of pockets, high deductibles. So get off that Ambetter plan the month you turn 65 and take A and B. And if money is tight for you, get an Advantage plan. If you can afford a little extra, get a supplemental plan. Yeah. Does supplemental plan replace Part B? In other words, you wouldn't have the Part B premium plus the supplemental. Would you? Oh, no. Supplemental plans do not replace Part B. What they do is they fill in the gaps that B did not cover and the gaps that A did not cover. So no, if you have a supplemental plan, you have all the above, and that's going to be in the neighborhood total. Remember, Part B premium right now is $174.70, unless you're high income, single above 103,000, couple above 206. But if as long as you're below those thresholds, Part B premium is $174.70. Average G plan is about $125. Average N is about $100. And then you got a drug plan, depending on your meds. There are several of them that are very, very low cost. So you need to know you're going to spend about $275 to $300 for sure with A and B and your supplemental plan G or N, right around $300. Can a spouse continue 2 days if the other retirees on Medicare? Absolutely. Yeah. They can only contribute the individual amount, which is $4,150. The couple right now is $8,300. But that spouse can also do the catch up for an extra $1,000. So yes, they can. As long as they're not on Medicare, they can continue to contribute to their account, which could be used for your expenses. You just can't contribute to a family plan once that person's on Medicare. Okay. You still have to pay the Part B premium with the supplemental plan? Yes, you do. Yeah. The only way you can get an Advantage plan or a supplemental plan is to be enrolled in A and B. So you got to pay your B premium in both of those systems. All right. We're going from plan G to N. Require underwriting. What scenarios don't require underwriting? Okay. Well, I have definitely covered this earlier. So thanks for joining in now. G to N. In most states, yes. Most states, it is going to require underwriting. It will not require underwriting if you live in a birthday rule state. Birthday rule state. California, Oregon, Washington, Idaho, Oklahoma, Missouri is called anniversary rule. Illinois, state of Maryland, New York, Connecticut, Maine, Massachusetts, Vermont. Those states have special rules for not having to qualify. And so call in, we write in all those states, and we will specifically tell you how it's going to work. But if you're going to move from a G to an N in a birthday rule state, you can do it without underwriting. If you don't live in one of those states, it's going to be required. The supplemental plan G have deductibles? Yes, one. And the plan G, it doesn't really have a deductible, but Medicare has 2 deductibles, and the G plan will not cover the Medicare B deductible. Okay, so it's not really the G. Original Medicare B deductible this year is $240. If you have a G plan will not cover that. It covers everything else but that. Okay, I turned 65 January, retired this September. Torn between the old Medicare plan, Advantage plan. My husband's still working 3 more years on a high deductible plan. Should I go on his? Well, it just really depends upon your health. And what it cost him to be covered. I'm going to cost him to cover you on the plan. If it's high deductible, it's probably very low. And so it is fine, Nancy, to go on your husband's work plan. And I suggested if you like the coverage and you're comfortable with it, as long as there's, remember, 20 employees on the payroll or more, you don't have to go on Medicare. As far as being torn between old Medicare and Advantage plan, I understand. Advantage plans have their attractions, but you got to remember, you still got networks, you still have pre-authorizations to deal with. And if you're on the Advantage plan year plus, now you got to medically qualify to get off. So you just have to decide whatever risk you're comfortable with. All righty. When I began navigating the Medicare experience, it was one call to your agent, and all I do is my side was easy. Application for Medicare to your agent flew through. Very good. Well, hey, Danny, thank you. We appreciate the compliment, the encouraging words, and we truly want everyone's experience to be just like that. We're not perfect. I wish we were, but we strive hard to make sure that we take care of people well. Thank you. All right. If I don't start your Social Security until FRA in December, but I start Medicare in June, does the full payment come for me? No. Let me back up. Okay. Does the full payment come for me until December? Yes. So what'll happen, let's go back through it. So for retirement age December, that means you're going to get your first check in January. If you start your benefits in December, they're always 1 month in arrears. So if you start your Medicare in June, from June until December, because your first check comes in January, from June to December, you're going to be on a direct bill basis. And the way to do that is either the direct bill is quarterly. And if you don't want to pay quarterly, then you can set up a system called Medicare Easy Pay, and they'll do a bank draft until you start Social Security. And then once Social Security begins, they'll stop the bank draft. So the answer is yes, you're responsible. And then January premium will come out in January check. Marvin, thank you for your company. Okay, good. Hey, so you sign up for A and B, also have an advantage. I thought it had to be one or the other. Oh, no, you have to be enrolled in original A and B to have an advantage plan, or A and B to have a supplemental plan. Yeah. If someone had A only, they can't do either one of those options. If they had B only, they can't do either one of those options. So you have to enroll in A and B to get the advantage or sup. So after I took the supplemental plan, had several health issues, got in with the underwriting on my 65th birthday. Doctor says, that's exactly right. Yeah, the insurance company, folks, has no say-so on a supplemental plan. Medicare pays, they have to pay. No questions asked. No pre-authorizations either. When I call you guys, can I sign for Social Security at the same time I do Medicare? Yes, you can. Now, keep in mind, we are happy to do that with you and for you, but we want about at least 60 days to 90 days before you want everything to begin. Okay, because the Social Security application is going to take probably about 8 weeks to go through. And then once that's been approved, they'll set the Medicare up as well. And so if someone's down to the wire, we prefer to do Medicare first, let that go through, and then do Social Security after that. But if it's all tied together and we got enough time, again, 60 to 90 days, happy to help. Okay, Manx, number one, excess charges occur less than 5% of the time. Secondly, you can protect yourself by asking the doctor if they charge them. Most don't. Or if you live in a state, there's 8 states that do not even allow excess charges to be part of the bill. Okay. So if you live in one of those states, you don't have to worry about it all. So you can protect by asking. You can also protect by getting a G plan, because G plan would actually cover excess. Okay. All right. Okay, folks. Hey, listen, I've enjoyed this. I am tuckered out. We've enjoyed it. I hope you learned and watch some other things on our channel. And then remember, every Monday night, I do a live event at 5:00. You can join us on that. And then every other week we do these, call-ins where you can ask questions. All right. So call our company. We'd be delighted to help you. There's no cost at all to use our services. We are brokers, so we write for lots and lots of companies, and we'll give you the options, give you the ins and outs of all the carriers, and really help you to make sure that you're making the very best choice. The goal of our company is to make sure people have confidence when they go on Medicare. You take care. We'll see you next time.